Welcome back to another episode of Behind Beliefs and Behaviors. I am very excited today to be having this conversation. If you know me, I am all about empowering our doctors, empowering women, empowering human connection and behavior, and busting the myths that stand in the way of our transformation. And so we're going to have a conversation today called Midlife Champions: How Women Pivot When We Find Our True Passion and Purpose. And I'm having this conversation with a colleague and a friend, Dr. Ekaette Joseph-Isang, and she is a physician, a healthcare consultant, a public speaker, and the founder of RiteBridge LLC. And so I am so excited, Doc, to have you on today. How are you doing? I call my sister Doc. So how you doing, Sister Doc?
I'm doing very well. Thank you, Maisha. Thank you for having me. It's my pleasure to be here. I have certainly been looking forward to coming on your podcast. Thank you for all the great things you do, the great conversations you lead. I love listening to your podcast. It's my utmost pleasure to be your guest today.
Thank you. And thank you. You are always like amplifying and lifting up my content on LinkedIn. And I just so appreciate that. I mean, it just really means a lot when people find value and when they share it. That gives even more meaning for me when people find my content valuable enough to share it, because it means that I'm actually saying something worth hearing. So tell me, we've talked a couple of times, and
Mhm.
so I know your backstory, but I like for my guests to get to know who you are and what you do and how you came to be where you are. So if you don't mind taking a few minutes to just formally introduce yourself and give us your story.
Okay. So I currently work as a healthcare strategy consultant, and I know that could mean a variety of different things. But my specialty is in value-based care, population health, and
Mhm.
I like to tell people that clinical documentation integrity underlies all things.
Yes.
I know that as a former practicing physician, we typically run around so fast, we hardly have time to put down the things we're doing. So
Mhm.
I really work with providers to support them in their documentation, teach them the latest policies, and help them to understand all of the changing policies and how healthcare is always spinning around. So my clients typically are hospitals and payer groups. And so let's just say payer provider strategy. So how did I come to do what I do today? I was an internal medicine physician, but at the back of my head, I've always loved the business part of medicine. I've always seen how doctors tend to feel marginalized, like people don't understand us. We do so much, they don't get it. They keep putting on new things on
Mhm.
us. And I had a professor that told me, look, we struggle because the administrators and policymakers are not physicians. They don't understand. They're not seeing things from our own lens. If one of you could go into health policy and administration, you could change the lives of all of us because you'd have us at the back of your minds when you're putting up these policies. You'd help people understand how we think. And once my professor told me that, it just never left me throughout my days of practicing medicine. As I encountered administrative bottlenecks, I'll think, look, one of us needs to be on the other side. I need to be making my transition from the clinic into the boardroom, helping make life easy for doctors.
Yes.
So when the opportunity came, when it was just that time, when it's time, you can tell when it's time. I was
Mhm.
like, okay, it's time for me to move on to the business of medicine. And I did that through taking a couple of trainings,
Yeah.
fellowships, which were really hands on. And I cannot thank my fellowship funders enough because the fellowships I took totally changed my life and helped me understand and become that bridge builder, right? Between providers and all the other siloed spaces that we have to engage in. So that's really why my business is called Right Bridge, because I'm like, okay, I'm the bridge between the providers and payers, the providers, payers, and tech, the
Mhm.
patients and the providers. So I'm just there serving as that bridge. So that's how I got here.
I love that. I love that. And there was so many things that you said. Particularly what stuck with me is you had this conversation with this person who was like, what the reason that there's such a problem is because we don't have enough physicians on the administrative side that are in the boardroom having a seat at the table. And then it clicked for you in that moment. Oh, well then that's me. That's me.
Absolutely.
And so like you found that there was like that passion, it just came to you, that called to you. And then the other thing, I love what you do, like this whole piece of supporting physicians and documentation, because we know that number one, documentation is very important for physicians to get paid, but also it is part of the bane of our existence, right? With EMR and with the amount of inbox work and with all of the administrative things that we're now asked to do when clinicians want to help patients. So to have someone to be able to say, okay, this is how you do it in a way that number one is efficient and number two helps you to put food on the table for your own family.
Um,
And that is such a help for those who are in clinical medicine. And so I just appreciate we all have our roles in empowering our colleagues. And one of the things that I can see, because we know burnout is so high, is that what you do can really help to decrease the amount of stress and overwhelm for physicians who are like struggling in that area.
Absolutely. And truly, physicians struggle
Mhm.
because sometimes when you're asking physicians to do something else, in addition to they've spent time with the patient, sometimes you find the patient saying, we're not connecting with our providers. They seem like they're in such a rush to move on to the next patient. And
Mhm.
so the patients are complaining they're not getting the quality of care they should. And then we're using these high value resources to do work that I wouldn't call it not meaningful, but work that could be done by other people or in easier ways, or if you were to automate things or provide templates,
Yeah.
just give them guidelines, tell them just what to do, not overwhelm them with information. So I think this is about time that a couple of us really look into that space.
Absolutely. Let's talk about this world of moving from clinician to moving to putting yourself at the seat of the table and how that's manifested.
So when you first start out, and I don't know if that is what it is for everyone, but when you first start out, you either really think, I want to do this, or you don't even know what you want to do at all.
Right.
For me, I knew that I wanted to support providers,
Mhm.
and I really stepped into this space during the time when we were moving from paper records to EMRs. So I
Mhm.
was like, okay, let me take this route where I become an EMR implementation specialist. But then I
Mhm.
thought to myself, it's a lot of travel for me because I still had a young family.
Yeah.
But I totally enjoyed the work because when I was there as an at the elbow support for the providers,
Mhm.
they loved it. I was creating the smart sets, smart sheets for them, helping them with templates, and they just couldn't get enough. They would pull me aside. Oh, you're a physician. Okay, come, we want to work with you.
Yeah.
That was a lot of trouble, a lot of travel. And then I was like, you know what? How can I do this without travel? And how can I even take some extra training that makes sure that I'm totally equipped to do this? So
Right.
I went in search of a couple of for trainings, and then I found something through the CDC, the
Mhm.
Applied Public Health Informatics Fellowship, and that totally just boom opened my eyes. I'm like, oh, this is not just about providers and patients and payers. It's also the government payers, right? The
Mm.
policies that impact what we do. So the journey looks like different things for different people. Some people are able to transition, say a role opens up in the hospital where they work and they're like, oh, we need an administrator.
Yeah.
But someone like me, that wasn't how it worked for me because background, I trained as a physician in Nigeria before moving to the US.
Mhm.
So I went through a couple of fellowships to totally understand the system.
Yeah.
I did a health systems integration program fellowship. And
Wow.
so that's how that broadened my horizons. And I just saw that there were so many silos, there were so many directions I could take. So I just decided pay a provider strategy for me. And in the process, I found that, oh my goodness, policy, documentation, tech, and I just stayed there. So to your question, it can look like different things for different people. But for me, it started with a series of fellowships, and then it landed me with working in the payer space and consulting
Mhm.
with an ACO, and now doing my thing.
Yeah. I think what's really interesting, and I can speak to this as well, is that it's a progression when you find that, and I transitioned in mid-career as well. And so when you find that sort of next thing, next phase of our career, and I honestly am starting to believe that I'm a Generation X person, right? And I think for
Yeah.
our parents, the baby boomers, they were trained to be in one career for 60 years and then retire. And I think that while they did it, it's not the most sustainable for people who are always growing and developing and innovating. And so I do believe that one career is going to become a rarity, and that multiple careers and phases of careers are going to become the norm. And so just listening to your journey, it's like you developed this appetite for the next phase of your career, and you didn't just jump from one to the next. It was a progression of
Was.
educating yourself, a progression of really strategically thinking, of looking at, okay, well, my life will be this way if I did this, but no, this is the way I'd like my life to be. So structuring that next phase of your career around what you needed your life to be, like really
Absolutely.
around your life rather than what we were taught was to structure our life around our job, right? So that's a growth and expansion. And then like really strategically then narrowing down to what you most love to do. I loved hearing that in your speaking in your story, because I think a lot of people who are in early career or mid career who are thinking about a transition, they think, oh, well, it's just, I'm just gonna jump over here. I'm supposed
Mm-mm.
to know exactly what I want to do. But truth be
No.
told, I tell people I'm in my third phase of my career.
Absolutely. And it's the same thing for me. So, I went from practicing clinical medicine
Hmm.
to going into the private sector and to now becoming an entrepreneur. And it
Hmm.
was Alvin Toffler who said that the illiterate of the 21st century would not be the person who cannot read and write. It will
Right.
be the person who cannot learn, unlearn, and relearn. So even coming here as an immigrant, I had to learn a new culture. I had
Hmm.
to learn a new way of being. I
Yes.
remember my first 3 years in the US, I was flat out miserable. I was like,
Hmm.
oh my goodness, nobody likes me, like that, because things were so different. And
Yeah.
then my sister came from home and was like, what's going on? I'm like, I'm not happy. I'm not happy. I want to go back.
Yeah.
And then she went to this conference and she heard this lady talk about cultural competence.
Mm.
That's the author of a book called Culture Map. I tell everyone about the book, and then I read the book. Oh my goodness, it's a culture difference. There's nothing wrong with the people. There's
Yeah.
nothing wrong with me. It's just a
Yes.
culture difference. It's a way of being. And so as I started understanding the people, and I became more open to telling the people about my background, like, hey, this is who I am. These are my belief systems. These are my values. How can we get to know each other better? And so life generally is that. And of course, I've met some of the most incredible people in my life in
Mhm.
places and spaces that I least expected. Great bosses will do a lot for you and your mentality and your well being. So it's just been a journey. Learning to embrace that journey and not being afraid of the what next. Looking back to say, okay, I did it, I can do it. And then just finding the right people, like I found you. You
Yes.
found me. Learning to just go with the flow and trusting the process. It's how you get to where you need to be.
Ah, yes. And the most beautiful thing is when you can discover that true north, that
Yeah.
passion, as you well stated it, it is such a beautiful, like it's such a beautiful existence when you get in your pocket. It has been years of discovering, okay, am I saying the right thing? Am I in the right place? I went to burnout coaching, and I went into, after I left clinical medicine, I started coaching physicians in burnout. And I loved the space, but I felt like, oh, there's more, there's more, there's more. I started to speak. And I somehow discovered that I'm really good in front of the room. And I like it, even though I'm an introvert. And people, I'm telling you, every time I tell a person I'm an introvert, they're like, no, you're not.
No, not
And I'm
you.
telling God, say, look, I can sit at home in my pajamas all weekend and not miss a beat.
Oh
But
my
I
goodness.
love people. I do love people. It just takes a lot of energy to manage a lot of people. I found that this space of being trauma informed and creating safety and cultivating trust, because integrity is one of like my highest values. I found
Mhm.
that, oh, I'm finding that pocket and it's a need, and it's so beautiful. So I just love like when we find that space that
Oh
we're
yeah.
both good at and we love, we're passionate about, and we can
And
generate revenue. Those are the three things. What's this guy's name? Chicken Soup for the Soul guy. Oh gosh, I'm
I
blanking.
forget his name, but I know who you're
Yeah, you know
talking
what I'm talking
about.
about. That's what he
Yeah,
talks
I do.
about. And then the Japanese call it ikigai. Ikigai.
Ikigai. Find
Yes.
your ikigai.
Yes.
Yes.
I feel like I
Yeah.
found my ikigai.
Oh my goodness. I had to find my ikigai. I did all sorts of testing, my genetics profile, my
Yes.
Myers-Briggs,
Yes.
my what's it called? What's the other one? The Gallup survey. Like I kept when you're in spaces, you enjoy the space.
Mhm.
There's more to do. You want to help people, but you
Mhm.
also want to make revenue. You want to help people, but you want to make impact. You want to help people, but you want to use the things you studied in school.
Right.
Just want to be you. Like I can talk from morning to night for free. I like to talk. I like to picture. I like to learn. So putting all of that together,
Mhm.
having my own business, going out there, putting myself out there, speaking at events,
Mhm.
getting invited to talk to people in midlife transitions,
Yeah.
talk to immigrants who are struggling, helping immigrants transition into a new space. People
Yes.
who had established careers elsewhere, like I was already the head of a health insurance company in an entire state,
Yeah.
needing to move here and start life afresh, needing to arrive with two bags and just say, okay, this is the new me. It's been quite a journey, interesting, sometimes stressful, but I couldn't have had it any other way because you know what? It's how it was meant to be.
And let me just acknowledge you because you said something that I've just like, it really has always like not perplexed, but just struck me. Because I've met a lot of people from a lot of different countries that have done this. To be a whole physician and have a whole career in another country, a highly respected position in a
Mhm.
whole other country that you worked years to get to. And then to move to another country that doesn't recognize your credentials in the same way and have to start over, what that must take, like the resilience that must take. And so I have to like for you and for all the people who have come from other countries here to have to do that. I have to give you your flowers. Yeah.
Thank
Yeah.
you.
Just have to say that
Thank
because I
you.
mean, oftentimes I'll be in an Uber and the person I was a lawyer in Peru or I was my CP my accountant. She has gone through a whole master's program in accounting and taking her CPA. So she was a whole CPA in Peru for many years. And now she had to come here and start all that stuff over. And she was doing accounting, but she not at the same credential level. Now she take her CPA series and make the amount of money that a CPA should be making.
My goodness, yeah. It's a ton of work, and I can see how it can be a struggle for most people. That's part of why in RiteBridge, in my business, I have the portion called RiteBridge Academy,
Yeah. Oh.
where there's a RiteBridge Academy that started out as a service to foreign trained physicians like me to help them transition into other career spaces. So sometimes people arrive at an age where they're like, no, I'm not going to go back and start from scratch. I'm this age, my children are teenagers. I just don't have it left in me. I was already an administrator in my country, but I can take my medicine and do things with it. So at RiteBreed, we would train them to either become clinical documentation improvement specialists
Yeah.
or become population health SMEs or work in value-based care. There's so many things that a physician can go on to do that is not necessarily the practice of medicine, but adds a lot to the practice of medicine. And as a physician doing these things, learning policy, you can really bring your physician mind and your medical knowledge to be the best at what you do. And we've had a level of success that we're hoping to build on and expand and
Mhm.
probably get workforce departments in different states to sponsor the foreign physicians because our programs are not the least expensive.
Yeah.
They might not always be affordable for people who are job hunting, but it's got to be that way because I tell people it's a mini master's degree. Once
Mhm.
you go through our program, you're going to learn enough to take a couple of certifications. You're
Mhm.
going to learn enough to hit the ground running. And we
Mhm.
offer a support depending on the kind of job you get for you to always come back to us with questions. But I just don't think it's fair to have doctors being Uber drivers. Not that there's something wrong with being an Uber driver is a legit profession, but
Right.
hey, this person has put in 12 years of education,
Yes.
secondary education. They shouldn't be working as medical assistants. They
Right.
should have an opportunity to work side by side
Correct.
with practicing physicians, with policymakers. You know what
Mhm.
I mean? So
Yeah.
that was how RiteBridge Academy was born. And so we really do support foreign trained physicians to transition into other careers. Other people have come to us over the years, like nurses would come, people with other clinical backgrounds. But our passion is really to serve the foreign physicians. And some of them have been able to get a residency because they do get jobs within the hospital setting. And so people see them, they're like, oh, you're this smart, you know this
Right.
much. I'm like, of course, I'm a doctor. Hey.
Yeah. Yeah. I love
Yes.
it. That is
Yeah.
awesome. I think I love what you're doing to serve like your colleagues that may have not had the same success as coming and getting in a residency program or don't, like you said, don't have it in them. Like, okay, I was a whole like administrator, president of a hospital. And now, so I really love that you're like doing that retraining. And I think also it's for people who have gone through medical school that for some reason or another have found like residency may not be for them or they never were able to get into a residency, or people who have started a residency program who have for whatever reason health or have not been able to finish their residency program, or family, or they've had to come out for caretaker and they've been out so long. There's so many there's so many circumstances where
Absolutely.
you can get thrown off of your planned track.
Yes.
And in some cases could be difficult to get back on, or you just decide, no, this is
No,
not the path I want to go. And I feel like in addition to helping foreign med grads who come over here and physicians who have been practicing in previous countries, you can help so many people who are just having struggling even here, like just,
absolutely.
like life circumstances. So I'm just,
Absolutely.
yeah, I have my brain is ticking about all the people that you need to be connecting with that I might be able to support you with. And so you can get the word out about what you do. I think is just so important.
Yeah.
Yeah. Well, this is, I mean, this is such a good conversation. I
Okay.
appreciate you sharing your journey, you
Thank
sharing
you.
what you do. I think that maybe we should have have you back on to have a conversation specifically about what you do about the documentation, the clinical documentation, because one of the
Okay.
things I was thinking, I think there's a whole conversation in this about how clinical documentation and the work that you do helps to alleviate burnout in physicians. And so I want to have a specific conversation about that because I think organizations also need to hear that if you're going to,
Yeah.
if they might potentially want to work with you, what are some of the ways that people don't think about that can help alleviate burnout in their clinicians? And so let's, sort of I put it out there publicly because that's my accountability structure. And
Okay.
let's have you get you back maybe in a month or so and talk
All right.
about that.
That would be great. I love talking about clinical documentation. I tell people that's the bedrock for everything we do in medicine. If you did pictures or it didn't happen, if you didn't write it, it didn't happen. So how can we make that easy for doctors?
Exactly, exactly. Well, for those who want to reach out to you, either to have you come speak for their organization, to begin consulting, or who want to learn more about RiteBridge Academy, tell the listeners, how do they reach out to you?
So you can find me on LinkedIn, Ekaette Joseph-Isang. I'm on LinkedIn.
Mhm,
You can check out the RiteBridge website, www.ritebridge.com.
mhm.
Check out our offerings. You can also email me, info@RiteBridge. Of course, that's what it's going to be.
Yeah.
And my phone number, I'll leave when we post this video. I'll also leave my phone number in the comments on LinkedIn. It's 859-420-7585. But LinkedIn is the best way to find me. DM me, contact me, book an appointment. I'm just here to help and support and make everyone's lives easier.
Yes, and she's very responsive. We became LinkedIn besties, and so yes,
Yes,
reach
I will
out to her.
respond.
Yes, and we're gonna have all of Dr. Ekaette's information in our show notes, and if you're watching on YouTube, in the description. So make sure you reach out to her. Dr. Ekaette, thank you so much for
Thank you
coming
so
on
much.
and sharing your journey, sharing your wisdom sharing what you do and for supporting colleagues who need you in this space.
Thank you, Dr. Maisha. It's always a pleasure chatting with you. We could go on and on, but hey,
I
stop.
know I could talk to you all day. I could talk to you all day.
Um,
So listeners, I always like to thank you because guess what? Without the listeners, there is no podcast. Make sure that you remember to hit that subscribe button so that you don't miss an episode and share this episode with someone who this would benefit. This would be valuable to listen to, whether you're a physician or not a physician. It doesn't matter because we all have those midlife champion moments. We all have those moments where we're thinking about pivoting. We all have those moments we want to help our colleagues in whatever industry that we're in to be better, to feel better, to be empowered. And so, whether you're a physician or whether you're not a physician, you should pass this on because there's someone who can benefit from this. And leave a review and let us know what you thought of the episode. All right, so you know where to find me. I'm at mindremappingacademy.com. And until the next time we see you all, stay empowered.